Welcome back to Morning Barbados, and we're joined by two young ladies who I have a passion for because they're in the business of making people better, making people well.
You're passionate about nurses then?
Listen, I've always had a fixation about nurses, and for a long time I visited the QEH every day, sometimes 3 times a day, to commiserate with patients and to talk to nurses. I mean, I really enjoyed it for a long time.
I think they're unsung heroes in Barbados' medical profession, and there's so many good stories that go untold about the nurses in Barbados, whether it's private or at our main health institution. Having had a grandmother who worked as a midwife, I understand only too well how thankless the job can be.
Yeah, well, I had an aunt who was a nursing sister, and she passed on this last year, but she always told me wonderful stories about the hospital, dating back to the old hospital in the Tercentenary Ward. These ladies probably won't know about it.
Tercentenary Ward. Well, we're going to let them introduce themselves. I don't think anyone can do it better. Welcome to Morning Barbados. Tell us who you are.
Good morning.
Good morning.
Welcome. I'm Blondell Mullen. I'm the president of the Barbados Nurses Association. And it's a pleasure to be here this morning.
And it's a pleasure to have you.
Good morning. My name is Heather Dean. I am the first vice president of the Barbados Nurses Association.
You used to be called the Barbados Registered Nurses. What happened? You're no longer registered?
Yes. Yes, we're still registered, but we have changed our name to embrace everyone, including nursing assistants, health auxiliaries, all those who work in that caring environment.
While you list the different facets of nursing, for those of us who luckily or unluckily don't come into contact with nurses too often, what is an health auxiliary?
Oh, a health auxiliary is a health professional who is trained at the very lowest level in nursing. She is even below the nursing assistant. They only do a course for about 6 months. It can be longer, but the mandatory time is 6 months.
And they're all cogs in a larger nursing wheel,
yes,
right?
all members of the healthcare team.
What's new? What's happening? How safe is health? All of those fun things. Let's start with Blondell.
Yes, this morning we're here actually to invite everyone to the Eunice Gibson lecture. But this lecture is a part of our 75th anniversary celebration. The Barbados Nurses Association will be celebrating 75 years, well, actually from July until July 2012.
75 years as an organization. What are some of the major achievements of this wonderful organization over the years?
Over the years, we have excelled in many things.
What would you say have been the most significant accomplishments for nursing in Barbados?
Let's start with the founder, because the lecture is actually to highlight Eunice Gibson.
Yeah.
And Eunice Gibson is our founder. She is the person who started the Barbados Nurses Association 75 years ago, in 1936. And she, along with 11 nurses, who, because of, at the time, there was restlessness and the nurses were disgruntled, so they started the Nurses Association at that time. And Ms. Eunice Gibson, she was our first president. And she was the president for 10 years. And she also started the Nurses Benevolent Fund, which helped with the social welfare of the nurses.
I don't mean to start anything, but are nurses getting their due?
I think we are not getting our due. I think that, as you have said earlier, that we often work beyond the call of duty. We do so many things that the public are not aware of. And in terms of getting our due, I think we are not getting the respect that we deserve. And only yesterday, one of our nurses suffered some kind of damage to her car at the Sir Winston Scott Polyclinic. It is saying that the public somewhere along the line don't see us in the way that we should be seen. As their protectors, we care for them. And I think that somehow they've missed.
Well, how do you turn around the perception?
How do we turn it around?
How do you turn it around?
I think that we need to speak to the public more, to tell them what we are doing, the things that we are doing in their interests, and we need at times to communicate in terms of the hospital, especially the QBH. And I don't want to actually single out the QBH because it can happen in any institution, but I think that we need to take the public more into our confidence.
This brings us to the topic of the 16th Eunice Gibson Memorial Public Lecture. How safe is healthcare? If our nurses are overworked, underpaid, underappreciated, feeling threatened, how safe is the care we're getting from them and the rest of the health institutions that have their own challenges?
That is exactly the reason why we have this interesting topic, because we know people are querying if with all the conditions and people complain about the long waits at the healthcare institutions, and they're also complaining about professional behavior. But we want to let persons know that regardless of all of these complaints, and we do know that is only minority amounts that are complaining about these things, but the majority of people do appreciate and realize that Barbados does have quality health care. And that is why we ask the question, how safe is healthcare? And we know that you can do evidence-based research, and you will see that Barbados professionals, especially nurses, are well trained, and nurses train even doctors, I must say, and we are there always for the public of Barbados. So even, you will find out this at the lecture, but even though with all of these challenges that we might have, we can say that there's safe health care in Barbados.
Sorry, go ahead.
Yes, I really want to focus on the lecture, which will be Wednesday, the 7th of September.
And this is the Hugh Spring Auditorium at the Barbados Workers Union Solidarity House at Harmony Hall. It's the 16th Eunice Gibson Memorial Public Lecture. Ladies, thank you so much for coming along and highlighting the work and the efforts of nurses in Barbados. I believe you're underappreciated, and we'll do all we can to highlight your efforts.
We're looking forward to the lecture delivered by Mr. Ronald Best.
Yes, by Mr. Ronald Best.
And hopefully the question will be answered, how safe is healthcare? But in order to find out, you need to come out to the lecture. It is the 7th of September at 7 o'clock. Lots of interesting things to share there. Packed program, we're moving quickly along. We want to say thank you to our nurses. We'll be right back.